So you've gone through bedside reporting since you've been in the hospital here, and I just want to get some of your comments on how you feel about that process.
Well, they've done it from the beginning since we first came here, and it just, I guess my first impression of it is it's just a really good communication exercise. I mean, all the nurses come in from the shift before, and they, you know, everybody gets told what has happened from the beginning, and everybody's kind of on the same page and the same. And the other thing is we get to hear this every time they come in too. So it's like it keeps us updated on what has happened and how he's progressed. And so I think it's a very good thing.
Great. And any problems with the staff coming in first thing in the morning? Has that interrupted any of your your sleep? I mean, he interrupts your sleep probably anyways, right? So.
Well, we're used to getting our sleep interrupted ever since the baby came.
Exactly.
So that's nothing new.
Right.
Oh, it's been great. We've had tremendous care.
That's wonderful.
Can't say enough good things about the hospital here in Swift Current. We've had a very positive experience with our first time around here, and so can't say enough good things. It's been very good.
Great. Okay, thank you very much.
Our bedside reporting got started. The thought came about a year ago, spring and summer of 2010. We joined the IHI collaboration, perinatal collaboration, and one of their initiatives is bedside reporting. And then when we were starting into releasing time to care, we felt that this would correlate with the shift handovers. So in December 2010 we started the bedside reporting, and now in September next week we will be starting our module on shift handover, and during that we hope to do some improvements to our process of bedside reporting.
So our staff have come up with some comments for bedside reporting. There's both pros and cons from the staff's view and the patient's view that we've found. So a few of them are, the first one being that people don't like giving report in a semi-private room due to the loss of confidentiality, because there is a patient in that other bed and you have to speak loudly enough so that the rest of the staff can hear. So basically they're getting the whole rundown on their health information and everything about them in front of that other patient in the other bed. And we have 3 semi-private rooms, so that does happen quite often here. Also, there are times when we could allow our patients who have had very little sleep. We have postpartum moms here that breastfeed, that their babies cluster feed overnight, and then we wake them up in the morning when they've just fallen asleep. So 1 extra hour of sleep even would outweigh the need for bedside reporting. This would be, I believe, being an advocate for your patient, was one of the comments. A lot of people agreed with that statement. And even with good planning report, it still takes a very long time. Report itself is good, but it takes so much time walking back and forth from room to room and waiting for the next nurse to give report. And often that person that is coming to give report gets stuck answering call lights or answering the phones, things like that, and you have to find them before they can give report. With our nurse-to-nurse reporting, we do use medical terminology, and we're very much in that habit of doing that as a part of being professional between one another. So a lot of the time the patient isn't aware of what that means, and they will interrupt staff to ask, oh, what does that term mean, and then we'll have to explain it. Usually takes quite a long time. Also, patients are not given a choice whether they want to have bedside report, since we do it for everybody and we wake them up regardless to give bedside report. They're never given the option to have it or not, and some patients have had some negative comments.
Okay, thanks for volunteering to give us your comments on bedside reporting. Your wife has been here on Women's and Children's Unit for 2 days now, or?
Yeah, well, yeah.
2 days, okay. So, and you've both experienced the bedside reporting, and just if you can just give me your comments, pros and cons. on how you felt about it.
Okay, the pros were that when the ladies came in, I guess there was no male nurses, but when the ladies came in, they explained what was going on with the patient and the baby, but which is a big time pro because then the mom gets to know what's going on. But as far as when they came in, I felt a little intimidated because I didn't know what was going on. And there were 4 of them there, and they were all professionals. So I was just thinking to myself, what if something was wrong, right? And nothing was explained prior. So if they could explain that we're just doing a nurse shift change when they come in, then that would help the patients.
Right.
Because what if something was perhaps wrong,
Right.
right? And that's the only difference that they have to change. Other than that, it was great. Because when they left the room, I said, "Aaron, what was that?"
Right.
And Aaron said, "Well, they're just doing a shift change, so it's."
So it needs to be explained a little bit better ahead of time.
Yeah,
on
just what they're doing. That's it. They just come in and say, "We're doing a nurse shift change right now."
Right.
And Jesse, I'm explaining to the 3 other nurses on the ward what's going on at this moment. When I leave for my shift, they're going to know what's going on. That's all they needed to say.
Okay.
Yeah.
Anything, but otherwise, did you feel that it was beneficial to patient and the family?
Yeah, that was the biggest pro, is
Okay.
that knowing what was going on. If there were any problems, people know what's going on, and if there was any good things.
And how about the medical terminology? Was that something that was a problem for you? Was that...
That was fine with me.
Okay.
Yeah.
And you felt comfortable that you could ask questions if need be? Or they
no, because
didn't...
I didn't know what was going on.
Okay, right.
Yeah, I didn't know why all 4 of them were in there until after.
Right. Okay, great. Thank you very much.
Yep.